Assalamualaikum. I'm Dr. Tahira and you're watching program Health is Wealth. In matters of the heart, it is extremely important to pay heed to the voices of your heart. Not just your heart, but the heart of others as well. That is why you will watch today a detailed program on heart health. All you need to do to take care of your heart, what to eat, how to exercise and what not to do so that your heart remains healthy. Assalamualaikum, I'm Dr. Tahira and you're watching the program Health is Wealth. The matters of the heart are the most important and the most difficult to treat. That is why we thought why not discuss in detail what our heart wants to tell us and how we need to listen to it in time so that we can save lives. Let us talk about heart attack, let us talk about cardiac failure, angioplasty, angiography and everything we need to know about the heart. That is why we have with us today cardiologist Dr. Imran Ghani. Thank you so much for joining us, Dr. Saab, today. I cannot forget the day that I came to you as a patient with my father and the way you were so quick to act and the way you actually saved his life. So I'm actually indebted to you for the whole of my life and I'm sure a lot of your patients must be. So this life-saving thing that you perform, so let us talk about heart attack first and the symptoms of heart attack.
Yeah, thank you, Dr. Tahira and your team. It's a very good job and thank you for raising your voice for the heart problem because it will produce awareness among the people who don't have any information regarding heart problem, like most likely the heart attack. So heart attack is actually is the blockage of the one of the arteries which supplying to the main part of the heart. When it block, the deposition of cholesterol, when it rupture and there's a formation of the thrombus, so the blood supply totally occluded to that part of the area. So the patient start complaining of sudden onset of chest pain, radiating to jaw and left arm, and they associated symptoms like sweating, shortness of breath, palpitation.
So if a patient has this, for example, if somebody is doing their normal work and all of a sudden they have a chest tightness and a sharp pain that's radiating from this side to the back or to the jaw and cold sweats and everything, mostly what happens in our part of the world is they give them a soft drink, the white soft drink, and they say, oh please, it must be some kind of heartburn, indigestion. They confuse it with the indigestion. So how do we know that no, it is a heart attack that is happening and what should be the first line of action?
You're right, because most of the people which presented to us in a clinic, they have already ongoing chest pain, which is most likely angina, but they present that heart, it's not because of heart, it's some like stomach problem. But actually, most of the patients which I seen, they have heart attack. So somebody have sudden onset of chest pain and radiating to left arm and jaw and associated symptom like I mentioned you. So it must be taken as serious. So the best thing is that the patient should consult a nearby clinic and must do ECG because the first line investigation. By ECG we can diagnose the patient had heart attack or some stomach problem or some other problem.
So this time, they say that it's very, very important to be immediately going to a doctor. And there's something called an emergency kit where you put a nitroglycerine under your tongue. So should we have that in our, bag all the time, one nitroglycerine or one BP lowering drug or one aspirin for that matter? And should they take that before going to the doctor and rush to the doctor?
If somebody is like far away from the clinic, the best practice said that if he having some aspirin, like he should take the aspirin. But nitroglycerin I will not recommend because in one of the MI we call is inferior wall MI, which is strongly contraindicated because it lowers the blood pressure, and patient who had inferior wall MI and that condition blood pressure get down. If you give nitroglycerin, the blood pressure will lower down. So it's not normally practiced to give nitroglycerin, but the best way is to give him aspirin.
Okay, so you said that there are two main causes of this heart attack, right? Either it's an ischemic heart attack, all of a sudden the blood supply is somehow occluded, and what could be the other reason be?
Like the most common reason is the deposition of the
Plaque in
cholesterol.
it?
Yeah,
Okay.
and when cholesterol deposit, it take like 15-20 years. When become like more than 70%, it's causing symptom. But sometimes it is less than 70%, but patients still have heart attack. It's because of the plaque rupture.
Okay.
Like it become rupture, it activate
And it
like
travels to the other part.
and activate the platelets we
Okay.
call the white cell,
Yes.
and it clot formation occur, and because of the clot formation the blood supply is 100% occluded, so we call it a major heart attack. So
And when somebody has a major heart attack and we take them to the doctor, you perform a certain set of tests where there
Yeah.
are cardiac enzymes and there is ECG and everything.
Yeah.
If, for example, these cardiac enzymes, tropi and all of that are elevated,
Yeah.
you give them some sort of injection, then you take them to the cath lab where you perform an angiography and an, if needed, angioplasty. If you could, describe this process.
Yes,
Yes.
you're right. Before that, I'm going to explain to you that we have two type of heart attack. One is we call is major heart attack, and major heart attack, the vessel become 100% occluded because of thrombus formation. But in minor heart attack, we call is non-ST elevation MI, and that condition the blood supply is not completely occluded. So if somebody have major heart attack, we diagnose by ECG. So we rush to the patient to the cath lab where the cath lab facility is available, and the window period is 12 hours. If somebody have chest pain and present to the emergency department, and still we have 12 hours. So we need to go directly for primary angioplasty. We open the vessel and we put a stent, and we remove the clot sometime because the clot burden is sometimes more. So by putting a stent and open the vessel, the patient becomes stable, and we can avoid the damage because of the heart attack.
So when you talk about angiography, how long is the procedure, how invasive it is? Because people get scared, they tend to delay it. In fact, they don't realize that the more they're going to delay it, the more damage can be caused, right? So how long is this procedure? And if required, when you put a stent in it, how do you decide like how many stents do we put in? What are the kinds of stent?
Yeah, you're right. Angiography is a very simple procedure. We just put a cannula, we just numb that area, and we put a cannula, and it's take 3 minutes by performing angiography. Angiography is actually diagnostic. By that we can gonna determine which vessel is blocked. In acute condition, sometimes patient have like 3 vessel blocked, but at the time of primary angioplasty, we deal the vessel which is completely occluded and patient had heart attack. So the other vessel is being dealt after 2 to 4 weeks.
Okay.
But at the time of presentation, like patient had heart attack, we just gonna open the culprit vessel.
Okay.
And it's a very simple procedure. Same like angiography, angioplasty is done. Like we put a stent in, we call as angioplasty.
What kind of stents are available in the market, and how do you differentiate as to which stent should be used? How much is their life? What is their post-care after an angioplasty?
Stent is actually divided into two. Like initially, it was a bare metal; it was not coated with medication.
Okay.
But nowadays, stent are coated with medicine, and they have very good effect. But normally, the stent which is FDA approved, they are very good. And let me talk about the life. Life of stent is forever. It's a myth that it works for few years, but I've seen so many patients, if they take regular medication and lifestyle modification and risk factor modification, stent never block.
Okay.
I've seen, like I did angiography after 10 years and nothing happened if somebody is take to medication and lifestyle modification.
So this is about angioplasty and
Yeah.
opening a stent. What if somebody has so much of blockage that it cannot be opened by stents alone,
Yeah.
and they require a bypass, which they call grafting and all of that. So what is a bypass? How big of an operation that is? Why are people so scared of it? And should they go for it or not?
Bypass is actually a major surgery, and that condition we gonna open the chest, and we just bypass, like we take the graft from the
Okay.
legs, and there's a native vessel is called vasculema,
Right. Yeah.
and we just connect to the native vessel,
Okay.
and we just bypass the disease of the vessel. Bypass is mortality is about 5%. Like if we do a surgery of 100%, then 5% people die because of cabbage.
Okay.
But it's a good outcome. It's take like 1-2 months for recovery.
Okay. So
But
this coronary artery bypass grafting that you said, it is not necessary for most of them. Most of them are okay with the stent, right?
yeah,
So now let's talk about cardiac investigations. When somebody has symptoms like, for example, shortness of breath, or they have pain on walking or
Yeah.
exertion, what are the tests that they should get done on a regular basis?
yeah,
Yeah.
you're right. We see a patient come to clinic with different presentation, like we
Right.
call as angina. The angina is mainly is a pain because of heart.
Yeah.
So if somebody have like pain while exertion, so there are different tests of modality which is being performed, like which is easily available. Like we do initially ECG and echocardiography and other tests like exercise tolerance test. But in some cases, patient is unable to exercise. So in that condition, we advise thallium scan, and the most important which nowadays available is CT angiogram,
Okay.
which is 99% sensitive, and it is non-invasive procedure. By that, we can determine whether the patient has blockage or not.
Okay, so what are the predisposing factors of heart disease? Like, is it obesity, or it runs in the family, or it's a high, what are the factors that lead to heart disease mostly?
Yes, a good question. There are two factors. One is modifiable and one is non-modifiable.
Okay.
Non-modifiable mean we can't modify, like age, gender, socioeconomic factor. These are the factors which is normal. Like increasing age increase the incidence of the heart
Okay.
disease, and male are more prone to as compared to female. And racial factor as well, like heart disease is most common in white people as
Okay.
compared to black. These are the non-modifiable. But some modifiable factor which I seen is the most big factor which I seen in my clinic is the family history.
Okay.
Like somebody have family history of heart disease, there's more chances that the patient will develop the heart disease.
Okay. Obesity.
Besides that, there is diabetes mellitus, smoking, hypertension, diabetes mellitus, obesity, stress environment, sedentary lifestyle,
Yeah.
and dyslipidemia. These are the
Okay.
modifiable factor which is the culprit for the ischemic heart disease.
So do you suggest that everybody who's above the age of 40 now, they should go for an entire like ECG and then lipid profile, and what other tests would signify, like for example, which one should they do, an ETT, an exercise tolerance test, how important is that?
It is usually normally recommended, like a patient who has been more than 22 years, he should check his lipid profile every 5 years.
Okay.
And if somebody is above 40, he must go for ATT
Right.
once in a year or once after 5 years. And nowadays is recommendation, if somebody is above 50, he must go for CT angiogram. These are the screening tests.
Right.
Because early diagnosis, you can pick the disease,
Yeah.
and early treatment, you just stop the heart attack.
Right.
So these are the screening tests for the.
So if we talk about, for example, weight, so what kind of weight management plans do you give to people, and how do you advise them that they quit smoking, they control their weight, and what should they be eating for good, ideal cardiac health?
Yeah, I just mentioned you that obesity is a big risk factor for the heart problem, because it's contribute a lot of I just mentioned you this because of cholesterol deposition inside
Yeah.
the vessel. So obesity also play a role. Obesity also is a cause for the hypertension and diabetes, which is also play a role in the
Okay.
heart disease. So obesity can be reduced by lifestyle modification and risk factor modification. Like lifestyle, we can do regular exercise.
How much of cardio do you advise to a normal individual who has a pretty sedentary lifestyle? Now, not everybody can afford the gym or go to the gym. So how much of brisk walk is ideal?
Ideally, 30 to 45-minute brisk walk
Every
is
day.
recommended
Okay.
as per guideline
Okay.
for the healthy life.
And what about the diet? Should it be like fat-free? Should not have trans fats, oils? What should we avoid?
The food which is required for the healthy heart is food which is less of oil, less in fast food, junk
Okay.
food, but it's high in fibers
Okay.
and
So more green leafy
vegetables,
fruits and
yeah,
vegetables.
and fruits.
And what about olive oil? Are vegetable oils better than these trans fats or saturated fats that we call?
Yeah, plant oil is good, or plant oil is good, but it's not 100% safe.
Oh,
But we need to reduce the oil intake as well. But it is required for the body energy as well. As I mentioned you, the plant oil like olive oil, mustard oil, they are safe as compared to other oil.
And what about like beef or mutton is better, or the white meat like chicken or fish, for instance, is preferred over that, right?
Fish is very good for heart because it contain omega-3 fatty acid, which lower down the cholesterol and prevent the heart problem as well. Chicken is also like free from the heart if you just barbecue type.
Right.
But meat is like mutton and beef. Beef is normally you can take once
a week is fine.
Twice in a month, and mutton is once or twice in a week.
But a lot of people in our region are so focused on shinwari and kebabs that they take it every day, and then they have niharis and oil and everything in the morning as well.
No, it's bad practice because I mentioned you if you take it as barbecue type,
right?
So it
That's
a beneficial because meat is only protein. If you just mix with the oil, so you just convert it to harmful things.
Exactly. So this we have to do exercise and control our diet for our heart disease. What about hypertension? Because we tend to have a lot of salt in our diet, and then we have everybody almost has blood pressure, uncontrolled blood pressure, and they're not compliant with their medication. So what are the causes of blood pressure? What is an ideal blood pressure? How much should we checking it? How often?
Yeah, as I mentioned you, the blood pressure is one of the risk factor for the heart problem. Actually, blood pressure, if somebody has blood pressure is 140 by 90, then we call it the patient had high blood pressure.
Okay.
So blood pressure also contribute in the heart problem, like it damage the vessel and lead to atheroma formation, and sometimes when the blood pressure get very high, so it lead to plaque rupture as well, so leading to the heart attack. Beside the heart problem, it can damage the kidney and can lead to the stroke as well. So blood pressure can be easily controlled, like lifestyle modification, regular walk, weight reduction, reduce salt intake, and regular medication. These are the factors.
So how important is it to monitor your blood pressure, and on how many instances should it be more than like 140 by 90 as you said, and then you should start a medication, and then the importance of continuing that medication for life?
Yes, because somebody has blood pressure, so he need to continue his medication, and ideally should be like 130 by 80. It should be lower than that. It means it's a controlled blood pressure. If it is more than 149, it means the blood pressure is not controlled. So we gonna switch. We need to increase the medication dose, or we need to switch to other medication. So blood pressure, like if it is less than 130, 90 is we can tell is a controlled blood pressure.
And diabetes, you said it does cause heart disease, right? It causes cardiomyopathy and it starts affecting. So you have to detect, like you have to have the doctor see all these things as a group, for instance?
Yeah, because for the cardiologist, we have to see like all the things, because the other risk factor. We deal with the diabetic, we deal with the kidney problem as well, and hypertension as well, because all the risk factors. So we have to deal with all of these, because these are the factors which is leading to the heart problem. If we control the risk factor, so we can prevent the heart problem.
So this is myocardial infarction or something, that the damage to the heart because heart has been the blood supply is occluded.
Yeah.
What are the different things that, like for example, cardiac failure, when the heart is unable to pump the blood normally and you start seeing swelling and cough and all of that. So describe cardiac failure.
Yeah, cardiac failure is a good question. Cardiac failure, just I'm going to mention, talk to you in a layman word, that when the muscle of the heart become weak, so the power of the muscle become weak, so it supply less blood to the
different parts of the body.
So result of that, the patient complaining of difficulty in breathing, they have swelling on the face and the feet, and they fatigue, tiredness, and sweating most of the time. So most common cause of the heart failure is ischemic heart disease, like somebody have heart attack. If it is not being treated on the time, which I mentioned, you went to period as well. So heart become weak in the patient, and so we just put on medication. Beside the heart, ischemic heart disease, there's other disease which can like viral infection, we call it myocarditis, leading to the heart failure as well, and other like storage disease which store in the heart muscle.
So a lot of people confuse it because they keep having this, sputum and chronic cough, which they think maybe they have some respiratory problem, and their mind never goes towards the heart. And if, for example, if they have swelling, they keep thinking it's maybe because of some renal problem. And so, how do you tell patients that these symptoms, if you have these, or if the JVP is raised and all that, so you have to consider it heart failure, and then come to the cardiologist, get evaluated, and get specific medications to reduce your fluid overload?
It's a good question. I've seen so many patients who presented with difficulty in breathing, and they're being treated for like months in a year for chest problem. But when they come to us and we diagnose it, the patient had myocardiomyopathy. So how are we going to differentiate the patient have lung problem or heart problem? We're going to differentiate the heart problem is mostly occur exertional, while when you go, then patients start difficulty in breathing. While lungs, where somebody have lungs problem, they have difficulty in breathing while rest as well. Okay. So this is the main differentiating point. But other beside this, the heart cardiomyopathy patient have also swelling in the legs as well, and face as well, and they unable to lie down. Whenever they lie down, the blood inside the lungs comes up and they start difficulty in breathing. We call it orthopnea.
Okay.
Yeah,
so what is the difference? There are terms like angina, unstable angina, and So what is unstable angina and stable angina and Prince metals? What are the difference between these anginas?
Angina is actually term used for the
heartache.
For the chest pain.
Okay.
The cardiac pain is we call it angina. Stable angina, like a patient who have pain while exertion. Like whenever you go uphill, you're going upstairs, and when you exercise and you start paining in the chest, we call it a stable angina. Unstable angina is different from the stable angina. It can occur like different from the frequency. Sometimes it lasts for more than 20 minutes. Sometimes it lasts for less than 20 minutes. Sometimes it occurs during exertion. Sometimes it even after eating. Sometimes during sleeping, because sleep time, when we our heart rate down, so the blood supply to the heart become compromised, so patient have difficulty. We call it nocturnal angina.
Okay.
So these are the terms which is used for the. And one thing is that you mentioned that Prince-metal angina. Prince-metal angina is stress-induced angina.
Okay.
It is mostly common in the young female who have already stressed. So in that condition, patient have typical angina pain. But when you go for like stress test and angiography, the vessel is totally normal. Okay. So actually it's because of this test the patient have like spasm of the artery. So when there's a spasm of the artery, the blood supply get compromised. So because of the spasms, patient start of complaining of chest pain. So it's all related to the stress.
So we spoke about myocardial infarction and cardiac failure. Now there's something in the circuit of the heart as well, the electric circuit, which controls how fast it beats or if it doesn't beat. So these electrical circuit connected problems like fibrillation, atrial fibrillation or flutter. So how do we detect those, and what are the treatment options for those?
Yeah, electric problem is one of the problem of the heart, and although it's a very common, but sometimes patient present with electrical problem. Electrical problem actually like two type. In one condition, the heart rate get down, like slow.
Bradycardia.
Yeah, we call it bradycardia. And one condition, the heart rate get worse, like we call it tachycardia. And they have different. In case of bradycardia, we have option of like medication, but it's not very successful. So we
to
have
increase the heart rate, so we need to put a pacemaker.
Yeah, we put a pacemaker. But when some patient have like high rate, we like atrial fibrillation, SVT, ventricular tachycardia. We have like medical treatment, which is a rate-reducing drug like calcium beta blocker, and we have antiarrhythmic drugs like amiodarone, lidocaine.
Right.
This is used for the high rate. But if it is not working, then we have invasive procedure. We call it ablation.
Right.
So ablation is an invasive procedure which is 100% successful.
So what is cardioversion?
Cardioversion is actually we just give a shock to the patient when presented to the emergency condition. like a patient who have ventricular tachycardia, ventricular fibrillation. So it's a life-saving procedure, which is just we give shock and we just recover the rhythm of the patient.
So a pacemaker, what is the life of a pacemaker? How is it, placed in there, and what is the post-care of a pacemaker? How long does it last?
Pacemaker is actually used for the patient who have a low heart rate, and it's a 30 to 45 minute procedure. We have like we put a battery below the skin, and there is a lead which is fixed inside the heart. The lifespan is usually of the battery is 15 to 20 years.
Okay.
And usually we check the battery life because interrogation after every 6 months, and if the battery life is off, like finished, then we just change the battery, but the lead doesn't change because it's working for the whole life.
So if somebody is born with a congenital condition that involves these circuits, like, I don't know, the Wolff-Purkinje or something like that, what do you do for such children?
Yes, I mentioned you that this is the supraventricular tachycardia.
Okay.
I just mentioned you ablation is used.
Okay, ablation
commonly.
is done
Yes,
for them.
yes.
And what about children who are born with patent ductus arteriosus, or we call it commonly a hole in the heart?
Yes.
Is it a very dangerous condition? Should it be fixed at the young age itself or later on? And if somebody has, and do people have it like later on in life as well, and what are the symptoms as well as treatment?
Yeah, that's a good question. These are the disorder which is we call as congenital heart disease.
Okay.
Congenital heart disease is mostly diagnosed after birth when the baby is not growing well, and they have recurrent chest infection, and they have rapid respiration and tachycardia. These are the symptoms which like we clue and the patient might be having some heart problem, and we can be diagnosed with echocardiography. Like there are two type of congenital. One is cyanotic and one is acyanotic. Cyanotic means the skin of the skin become bluish of the
Okay.
face, lips, and toes and fingers. So it need to be dealt on urgent basis because very dangerous, and patient can die in early 1 2 months.
So you do a flap closure for this?
Yes, but sometimes like PD, there's a acyanotic disease like
Okay.
PDA, VSD, ASD, and we just two type of procedure which can be closed. We like device procedure, we just
Okay.
put without operation, but sometimes device is not fit for the closure. So then we refer to pediatric cardiac surgeon for the closure.
So it is important you do it early in life.
Yes, because it causes pulmonary hypertension and heart failure.
So the same defect, the ventricular septal defect or the atrial septal defect, does it present in adults as well, and do they require
Yes,
it?
sometime like when the hole is very minimal, they are misdiagnosed at early ages. But later on, when the patient start complaining and difficulty in breathing, and when the pulmonary hypertension develop, so
Okay.
in that condition we like diagnose in the adult age.
Then we hear a lot about valvular disease, that there are valves in there, and the mitral valve and the tricuspid, pulmonary aortic, and that they have some sort of problem with it. There's regurgitation and there
Yes.
are degrees. So what are these valvular diseases, and how do we go about them?
Yeah, valvular disease is one of the disease of the heart, and there's the two kind. Like in some cases, there we got a stenosis when the valve is like area is compromised, and one condition there is regurgitation. We call it a leakage. So in both conditions, the patient present difficulty in breathing, palpitation, early tiredness. So and that which give us clues that the patient might have some heart problem, and it can be diagnosed by echocardiography. So if like it have degree mild, moderate, and severe. And mild and moderate case, we just put the patient on medical treatment.
Okay.
But if somebody have like severe obstruction or severe regurgitation, we refer for the cardiac surgeon for a valve replacement.
Okay.
And valve replacement, we have two options like metallic valve and one is tissue valve.
Okay.
Metallic valve is usually recommended who is less than 65, and tissue valve is the patient who is more than 65, because
Okay.
if we put a metallic valve, we put the patient on warfarin, which is like a clot relieving factor medicine,
Right.
which keep the blood very thin. So there is a risk of bleeding. So that's why we recommend metallic valve in early ages.
Okay, so there is an option for, like, if somebody has a valvular disease, they can go for these surgeries and then
Yes.
their life can be saved.
Yes.
So what are these, when they talk about, there are 3 valves and 2 valves, so multiple valves can be replaced also?
Yes, sometimes patient like obstruction, just regurgitation, mostly like aortic valve, mitral valve, they are being affected. So
Okay.
we replaced, we call it a dual valve replacement. And in case of tricuspid regurgitation or stenosis, we usually don't recommend like your valve replacement. In that condition, we repair the valve.
Okay.
Yeah.
So when we talk about the, the side effects of smoking on the heart, what exactly, how is smoking damaging the heart, so that more and more people who are smoking and vaping and doing all sorts of these things understand the actual damage to the heart because of this?
Is my practice I seen after family diabetes, smoking is a very big culprit for the heart problem. But there are different way by which smoking can cause like the heart problem. One is that it can increase the blood pressure, it cause clotting formation, and third is that it increase the cholesterol level, and fourth is it damage the valve and leading to atheroma formation. So smoking is very big risk factor, and if we stop smoking, then we can equalize the risk factor after 4 years.
What about the supplements? There are a lot of supplements in the market like omega-3 or coenzyme Q10, or there are some herbal supplements
Yes,
nowadays
yes.
out there. Are they really good for your heart? Do they increase the, the health of the heart, the circulation, or not?
Yes, I've seen so many patients who used herbal medication,
Yeah.
but they're very effective, like
Tricardin is a
garlic and ginger
Okay.
and fish oil.
Okay.
Because fish oil contain, I mentioned you, omega-3 fatty, lower down the
So
cholesterol.
garlic, and is green tea also good for the heart,
Yes,
cholesterol lowering?
yes, because it lower down
Okay.
the cholesterol.
So basically all these cholesterol lowering things are either green tea or ginger, or you mentioned garlic.
Yes,
So these are the good
it's very
things for the heart.
effective. It lower down the cholesterol and keep your blood pressure down, and it's also work as a blood thinner as well.
Okay, let's talk about infections of the heart, for example, like rheumatic fever
Yes.
or these myocarditis or endocarditis. How does the infection get into the heart? Is it by like a tooth cavity or procedure, or what are the other ways that can actually affect the health of the heart, and how do you prevent it?
Yeah, infection is also play a role in a heart problem. Like you mentioned, rheumatic heart disease.
Yeah.
Actually, it is a bacterial infection, like a sore throat, and it damage to the valve, and it present later on, like 30, 40 years, like the the valve become narrow and become like regurgitation. So we have to ultimately replace or open the valve. So good oral hygiene can prevent this
And
from
not going to an unsterilized dentist.
Yes,
Right?
these are the
Okay.
things.
So what is endocarditis?
And infective endocarditis, and patient have infection of the valve.
Okay.
It actually is mostly common in patient who is IV drug abuser.
Okay.
IV drug, because they use sharing the needle,
Yeah.
and they don't sterilize while putting the
Yes.
drugs. So when the other condition, like we put a pacemaker,
Right.
sometimes catheterization, like
Right.
IG
Yeah.
catheter.
Hmm.
So it is the risk of the factor for the infective endocarditis.
Okay. So what is cardiomyopathy? That is known like the muscle weakness or whatsoever. What is that?
We already mentioned cardiomyopathy is actually a weakening of the heart muscle.
Okay.
And there are different ways by which, like the most common is ischemic heart disease, with patient and
Okay,
heart
so it
attack.
causes that.
Yeah, it is not being treated in a proper way, so the heart muscle become weak. So after that, the patient have difficulty in breathing, palpitation, and fatigue, tiredness, symptom like that.
Okay, so when we do an ECG, we see the rhythm of the heart,
Yeah.
right? And then when we do an echo, we see the structure of the heart.
Yeah.
So can you tell the difference, like all the things that you are able to see with an echocardiogram? That's why a doctor prescribes it.
ECG is just a graphical representation of the
Rhythm
heart
of the
rhythm.
heart, yeah.
By that we can diagnose that if there is some channelopathy, patient have previous heart attack. We can
Right.
determine this way. By echocardiography, actually is ultrasound of the heart. We just see inside of the heart. We see the valve, we can see the muscle, we can see the power of the heart. So everything can be seen by echocardiography. So it is superior to the ECG.
Okay, so you mean you can see the entire picture of the heart in a 3D image and
Yes.
decide what is best for them.
Yeah.
So when we talk about heart health, and we were talking about a different kind of routines that we need to do, what should we take in terms of medications for a heart? Is there anything like any specific medication if somebody is already suffering from heart disease? What are the medications normally
the
prescribed?
different medication like antiplatelets,
Yes.
like aspirin, clopidogrel, and beta blocker, and
I was referring to, for example, do we need to take like cholesterol lowering drugs, for
Yes.
example, fibrates and statins? Do you advise that to people who have,
atorvastatin, because somebody heart problem, atorvastatin or rosuvastatin is a mandatory drugs.
Okay.
Beside aspirin and beta blocker and ACE inhibitor, these atorvastatin, because it is used for the primary prevention and secondary prevention. If somebody lowered the cholesterol by using these medication, we can prevent the heart from damaging and from the coronary artery disease as well.
Right. And what about the role of diuretics? How important are those?
Diuretics is not commonly used, but somebody, I just mentioned you that in cardiomyopathy, patient having swelling inside the body and difficulty in breathing, so we use diuretic in that condition. So it just lower down the pressure on the heart, and we release the extra water inside, which is retaining in the body. So after that, patient feel good after diuresis.
All right. So when we talk about heart and we spoke about the damage, once a heart is damaged, is it irreversible, or is there any way to get back that damaged part of the heart if one person has had a myocardial infarction? And they also say that in young individuals it is more fatal because collaterals have not been developed, whereas in older people it is you can actually sustain it. So what is the way to get back that, regenerate that heart muscle?
Yeah, this is a different condition by which we can give more power to the heart, like we can cardiomyopathy can be reversed or not. So one is thing that the revascularization in the form of stenting and cabbage, a patient who have heart attack before. So if we revascularize, we can regenerate the myocardium. So this is the one of the way. But in some conditions, like we use medication. Nowadays, there are medication which increase the heart power into 5 to 10%.
Okay.
And other is the like devices. Nowadays, we have devices which can empower the heart, and we can improve the heart quality of the myocardium.
So what is heart enlargement or cardiomegaly? When does the heart become big?
Yeah, it's same like is a complication of the cardiomyopathy.
Okay.
When the heart muscle become weak and become narrow, so because of the overstretching of the muscle, it become dilated. So they have similar presentation like difficulty in breathing, palpitation, and orthopnea. These are the symptoms. And same treatment is for the heart failure, dilated cardiomyopathy. But in some cases, we use devices like CRTD and CTP, which can empower the heart. But it is very less common, like 5 to 10% chance that we can improve the heart power.
So if somebody is having shortness of breath, and before it was little and now they're having more shortness of breath, so what do you advise to them, that how do they think, what should their line of action be?
Yeah, but it depends upon the age. If somebody have like young, there's a chance that might be having lung problem or he have sedentary lifestyle. But if somebody is like more than 50, it need to be ruled out, because there's a chance that the patient might be having hypertension or underlying ischemic heart disease. So he need to go for echo and ATT.
And what other symptoms do we need to look out for? Is there any bluing? Or you said there is no bluing or cyanosis, right? There's no sign, or is it there?
This is congenital heart problem.
Only in
Somebody is
congenital
heart
ones.
problem, but it doesn't occur in acquired
So
heart problem.
what other symptoms would you have to be considered as red flags, and people need to identify them and think, okay, that I have a heart problem, I need to visit a cardiologist?
Like I mentioned somebody have difficulty in breathing while exertion, and exertional chest pain, and palpitation, tiredness, sweating, and these are the symptoms.
Getting tired as well when they start.
Yes, because female patient and diabetic patient and elderly patient, they mostly present with tiredness.
With tiredness and lethargy and everything.
And there's underlying
So what are the
heart disease.
possible causes of palpitations, or when somebody has a very fast heartbeat, what could be the different reasons for it?
Yeah, just mentioned you previously that could be anxiety, most likely anxiety.
Most likely,
but there's
okay.
some.
So how do you differentiate a panic attack?
We like by taking history
Okay.
and performing some tests we call as a Holter test. But sometimes there's a like extra fiber which is causing for the palpitation,
So you ablate
atrial
that
fibrillation, SVT or ventricular tachycardia. And by that we initially we give medication. If it is not controlled with medication, then we advise for ablation.
Okay, when you spoke about Holter monitor, could you
Yeah.
tell the patients, like how that is given to the patient, where is it placed, and for how long they need to keep it there, and what does it exactly do, and what does it tell the doctor?
Yeah, Holter is basically is a ECG monitoring. Like we do ECG, we just have diagnosis on the spot. But sometimes when palpitation, when it comes to the hospital, they don't have the palpitation. So actually, Holter is just 24 or 48 hours of monitoring of ECG. While somebody presented with the dizziness, syncope, like palpitation, so and we advise in that condition with it because of bradyarrhythmia or tachyarrhythmia, like the heart rate is worsening or getting down. So these are the like causes which is causing these symptoms like palpitation, dizziness, syncope. So in that condition, we advise.
So a lot of patients, they complain of this sudden low blood pressure and fainting and
Yes.
syncope. So what is the relation of the heart with this condition?
Yeah, there's somebody have like weak heart, so it produces a low pressure. So
Okay.
the blood pressure remain low. So they mostly present with dizziness while standing up. And same time we are giving medication as well, which lower down the blood pressure as
Right.
well. So these are the factor which is contributing for the low blood pressure. But normally we just give those medication which don't decrease the blood pressure and keep the heart up.
Okay. So what would your advice be in general to all our audience out there regarding heart health, regarding heart investigations, regarding the right time they need to see the doctor, and the procedures that they don't need to fear?
Yeah, heart is, I mentioned you that it's a vital organ of the body and it's has a major role in the body. And heart disease can be prevented, but actually it need education. In our society, we don't have like information because of lack of education, lack of interest in
Yeah.
society. So early, like we can prevent the heart from damaging to the heart. Like we can do risk factor modification, like we can do regular exercise, healthy lifestyle, and diet modification as well. Like we take like low cholesterol diet, and we take fibers, and we take vegetables, fruit, and healthy diet, and just control the blood pressure, control the sugar, and control the cholesterol. So these are the things which can prevent the heart from damaging.
All right. And when we speak about stress, you said that Prince Metals was due to stress, and we
Yeah.
have a very stressful lifestyle
Yes.
these days. So are there any relaxing, techniques, or do you advise your patients to go in for some kind of, relaxation mode to avoid these heart disease and as well as these sudden episodes of heart attacks?
Yeah, initially it was like people saying that the heart is mostly occur after 50, but I've seen young
Yeah.
people like 25, 30 of age and they suffer from heart attack, and the big reason was the stress. So I just like stress is one of the risk factor for the heart attack. So how gonna we relieve? Like our environment, we just keep ourselves to the duty and everything. We don't give any time to ourselves. Stress can be relieved like if you do regular exercise, giving your time to your family and like to your friends. And sometimes if it is not helpful, then we use medication for the
Right.
stress as well. And by that, if stress being relieved, we can prevent the heart from damage.
Okay, what is BNP? What does that stand for, and how does it tell us about the prognosis of heart disease or its treatment?
BNP is actually a laboratory test which is commonly used for the patient who presented with difficulty, and we suspect that the patient might having heart failure.
Okay.
So BNP is just because of the stretching of the heart muscle,
Okay.
it release into the blood, bladder. So by that we can determine whether how much patient is stress, like the heart, how much heart is the stress, and by that we can decide how much diuretic we need to give the patient, and we can just have a clue about the patient recovery as well. If it is getting down, it's mean the patient is responding well.
Okay. So what is the most common surgery that you're performing over here right now in the hospital, and the most common presentation that you need to face with, so that we get a fair idea of what is the major problem in Pakistan right now?
Heart problem is a major problem all over the world, but same in Pakistan.
So number one killer in the world,
yes.
in fact, yeah.
Like we see the statistics, like Pakistan, like 900 people and like 100 people, out of 100,000 people, 900 people is being suffered from heart, and 29% deaths in heart because of the heart.
Right.
And one person die because of heart every minute.
Oh my God, that is a very,
So,
very huge
yeah.
incidence. So what would be your concluding message to everyone out there before we say thank you to you, Dr. Sahib?
So my last message and will be for the whole audience is that we can protect our heart by early diagnosis, early prevention, and lifestyle modification.
Thank you so much for joining us, Dr. Imran Ghani. We had with us cardiologist Dr. Imran. Thank you for giving us the time where he explained to us in detail that it is mandatory for us to take care of our heart. We listen to matters of the heart, but we ignore its very physical manifestations or presentations that are coming in front of us, and we keep going along without taking care of our health, without quitting our smoking, without exercising, without taking care of our diet, and that's when the heart attacks all of a sudden. So let us listen to our heart and to the heart of others so that we can bring down this number one killer and fight heart disease from today. Thank you so much for watching. Inshallah, we'll meet you next week. Allah Hafiz.